All right, so here with April. Say hi, April.
Hi.
So April, like many of our patients, would like to see an improvement in her jaw. I'm just going to turn you right to the camera initially. I'd like to see improvement in the jawline, neckline, and we're going to do this non-surgically today by building into the back part of the jawline to help create what we call kind of a fake lift, create a lower face neck lift approach without actually doing surgery. So let's see. So the area that we're after filling, the area that we want to fill, is if you imagine the little triangle above my Q-tips and below her jawline, right there. That's the area that we're after. And we're also going to put a little bit in front of the jaw. So we'll create one good jawline. All right, let's get started. Okay. So as many of you know, I love this canula technique. Let me see if I can do it from this way so you can see it at the same time. This canula technique bruises and swells and hurts a lot less than the needle technique, which is great. April, you doing okay? I think you can already start to see an improvement in the jaw. Is that showing up on camera? Okay.
Yeah, definitely.
Perfect. It's already looking better. So this filler is purlane. Good choices here would be purlane or voluma or sometimes radius. But I want a filler with a higher, what we call G prime, a higher degree of stiffness to it. Because what we're really doing is simulating the sharper angle of the jawbone that April had when she was younger. Our actual bones change as we age. You get a better sense of that jawline showing up? So we're not raising the jowl in this case. What we're actually doing is lowering the jaw back to where it once was, because both changes have occurred with age. The jowl has lowered and the jawline, believe it or not, is raised. So one of the big chewing muscles attaches there. So what did that take? Not quite 60 seconds maybe? Again, this is purlane. It's actually going to be renamed Restylane Lift. It's going to be the same actual molecule, but you'll be seeing it in the media advertised as Restylane Lift, L-Y-F-T. And it's a great choice for this particular area. All right, now we're going to do a little bit towards the front. You doing okay?
Mm-hmm.
Okay. A little bit towards the front here. And this also be a good place for either voluma, purlane, which is now called Restylane Lift, or radius. You feeling okay, April?
Mm-hmm.
Pain-wise, not too bad?
Oh, no. It's fine.
So now let's have those Q-tips again. And there's our new jawline. All right, pretty much exactly as we were hoping for. And again, our goal, we're going to take these two Q-tips and we're going to match them up and we're going to fill the gap right above there. And again, we want these stiffer fillers. It really does a good job of creating a line. So we're about a third or halfway done with this jawline now. Do any of them know these ready for me?
Yes.
We call this procedure the fake lift. But it has real results. It's a fake lift with real results. Creates a jawline non-surgically. And that's what we do in our practice to be able to give someone enough filler to make this kind of change, is we actually significantly discount filler after about the third syringe. So starting with syringe 3 and working our way up, we significantly discount filler. And actually for this procedure, what we call the fake lift, I usually just make it a fixed price and say this is what it's going to be. And then we just use enough filler to get the job done. So then you get a good sense. Can you see that okay? Yeah, that's a really nice jawline. It's almost hard to find her jowl anymore, which used to be pretty prominent right here, because we built that jawline down to match it. Same thing. Nice clean jawline. And I'll let you see.
Oh, very nice.
Isn't that neat?
Mm-hmm.
So very little else. So that's it. That's what we call our fake lift,
Yeah.
lower face neck lift. April's very lucky. She's actually got well-preserved cheeks. She's got beautiful cheeks. And many people will do the same kind of thing and will do it out here because they're starting to become narrow. But she's got great cheekbones, so she doesn't need that. But it's another thing that we'll often do with this procedure. I think sometimes we're missing the boat by filling a ton in this zone. this wouldn't have been helpful. It's this part that she used today. Thank you so much.
Thank you.